adipose or fat as a regenerative agent. This has been used far more prevalently in the last 5 to 10 years. Bone marrow was much more prevalent prior to that point in time. Fat is your major energy storage organ of the body. And it's strange that there would be a lot of stem cells there, but there are actually more stem or regenerative cells in fat than there are in bone marrow. And I've done dozens of studies over the years on how to acquire adipose or fat through very small liposuction procedures to receive the best tissue graft that we can. In my current clinic, there are 3 different iterations of adipose that we use, from raw and barely changed at all to broken down so I can actually take the skeleton of the fat to be used as a structural agent, to using the progenitor cells directly out of adipose. It's important to understand that from a regulatory standpoint, we need to be very careful about where we use adipose, because currently the FDA is concerned about it being used illegally as a biologic drug. And that's important to understand for anybody considering regenerative therapies. There are regulations regarding what we use, where we use it, and how we use it. And I have somebody on my advisory board that's an attorney that is very at the front end of this. I was also at the clinic that was shaken down by the FDA in 2010, and got to see the whole process over a 3-year period of time of the FDA scrutinizing what was okay and what was not okay. The adipose tissues can be used for a myriad of different conditions. When I use them for these conditions, I make sure that they're being studied and have been cleared under an institutional review board to be able to be used. But for arthritis, for tears in tendons, especially for neurologic conditions, adipose tissue is extremely effective. Again, how it's processed and how it's placed is very important also, but we'll talk about that in a different section.